All right, so a lot of us could not wait for our chance to get a COVID-19 vaccine. And I'm speaking for myself here, but we know that there are many women who are either pregnant or trying to get pregnant who say they are still afraid to get the shot.
There are still lots of questions doctors just don't have the answers to yet, and that has made it easy for baseless rumors to spread online.
So, for example, some people have tried to claim that the vaccine could affect your fertility. But News 6 Morning anchor and health reporter Kirsten O'Connor talked with Dr. Rachel Humphrey, who works with women with high-risk pregnancies at Advent Health Orlando, who says there is no reason to believe that is true.
And the first question I have for you is really just, does the COVID-19 vaccine or any of the three affect a woman's fertility?
So I'm so glad you asked, and the answer is no. So there was definitely some misinformation that got spread through social media that somehow either the vaccine itself or the immunity that comes from the vaccine could somehow cause infertility or even miscarriages. And so what we know from many women who've actually been infected and have natural immunity, as well as people who've been vaccinated, is that the immunity or antibodies that you develop are not associated with infertility and don't cause miscarriage.
I obviously was just pregnant, so I know a lot about the restrictions and all the advice that you get from your doctor about making sure that your diet is healthy and, physical exertion. There's a lot to consider for women who are trying to become pregnant. So how can you reassure them that a brand new vaccine is going to be safe before and during pregnancy?
Certainly pregnancy is a different medical condition for a mom or a different natural condition. But what we know is that through multiple studies, through science, that the vaccine works, that pregnant women get the same benefits of immunity. What we also know is that the vaccine is not associated with pregnancy complications. So the CDC tracks the women in the United States who have gotten this vaccine in pregnancy. As of today, we've got over 106,000 women in this country who've been vaccinated with the Moderna or Pfizer mRNA vaccines with no serious negative events associated with the vaccinations in pregnancy. And that also includes women who've been vaccinated within 30 days of getting pregnant.
What has been your biggest challenge with your specialty during the pandemic?
The biggest challenge that I've had to deal with through this whole COVID crisis is constantly battling misinformation, and it's fascinating how sort of exhausting it gets to sort of hear the same misinformation come up again and again. And so one of the things that I hear very frequently is that the vaccine will cause miscarriages or infertility, and there just isn't any data to support that. And I do the best I can. I talk to patients, multiple patients, every day about it, and I don't know how to get ahead of that, to get that message out to patients.
What would you tell one of your patients who is trying to get pregnant, but worried that if they get this vaccine while they're in those months leading up to getting pregnant, they may have trouble, or they may start to associate the vaccine with that long wait?
I've had patients that even though the data that we have is that the vaccine is safe in the first trimester, I have had patients who've said, Dr. Humphrey, I'm waiting till I'm 12 or 13 weeks pregnant to go ahead and start that vaccine. And I think that that also is very reasonable if you're willing to take the steps to stay safe before that point. Because what we do know very clearly is that getting COVID-19 in pregnancy significantly increases the chance for the mom to end up in the hospital, about 2 times more likely to end up in the hospital, about 3 times more likely to end up in the ICU. And I certainly have taken care of many women, even early in pregnancy, in the ICU with COVID-19 in the past year here in Orlando. So we definitely want to make sure that patients are making the right choice to stay safe and to eventually get vaccinated.
Wow, I can just tell you, I was listening to every word she said. She was my doctor. I had no idea we were about to interview her. Everything she says, I would trust 100%. I know she literally saved my kids' lives, and I know many other people. I'm starting to get choked up because, and it's hard to hear her say that she has to battle that misinformation every single day.